Audience. Alright. According to the Center for Disease Control and Prevention, or CDC, over 30.3 million U.S. adults have diabetes. Of this population, 1 out of 4 don't know they have it. The CDC also notes that diabetes is the 7th leading cause of death in the United States. Tonight, I'm here to tell you about diabetes. Diabetes is a prevalent issue here in the Central Valley. Working in the pre-hospital field, I'm exposed to many patients who are diagnosed or have this condition, in particular, type 2 diabetes. My presentation will begin by defining diabetes, identifying the different types of diabetes, and how it affects our body. Since type 2 is such a common condition, I will conclude with suggested treatments. Let me begin by defining diabetes. The National Institute of Diabetes and Digestive and Kidney Diseases defines diabetes as a disease that occurs when your blood glucose or blood sugar is too high. There are 3 types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes is a condition that occurs when your body does not produce insulin. It is usually diagnosed in children and young adults. Type 2 diabetes is a condition where your body produces insulin but does not use it very well, and is the most common type. This condition occurs most often with adults and is referred to as adult onset diabetes. Gestational diabetes is a condition that develops during pregnancy and resolves usually after delivery. Now that you know more about diabetes and the different types they are, let me explain how diabetes affects your body. In order to function and live, we need a source of energy. We obtain this energy from the food we eat, such as starches and sugars. These are commonly known as carbohydrates. After we consume these carbohydrates, the energy source remains in our body but cannot be used. For our cells to use this energy, we need insulin. Having diabetes limits or denies our bodies of insulin. Being diagnosed with diabetes can lead to other health issues such as heart and blood vessel disease, which can lead to heart attack, stroke, kidney failure, blindness, and or nerve damage. Now that you know more about diabetes, I will focus on treatment for this condition. According to the American Diabetes Association, type 2 diabetes is the most common form of diabetes and is a result of poor diet and sedentary lifestyle. Prevention is the key to treatment. Since this condition does not show any signs or symptoms, it is imperative and important and recommended to get tested by a physician. If screened by a physician, individuals may be determined as pre-diabetic. Being diagnosed as pre-diabetic is a warning sign that if changes are not made, you will become diabetic. The pre-diabetes phase is a time to implement healthy lifestyle choices and nutrition. The Gale Encyclopedia of Diets laid out a specific diet plan for diabetics. It focused on controlling blood glucose levels by focusing on food choice, portion size, and timing of meals. The article noted, in people with prediabetes, following a diabetic diet can stop or slow the progression of diabetes and can also help overweight and obese individuals lose weight. Regular physical activity is recommended in tandem with a diabetic diet. Other treatments addressed from the Gale Nursing and Allied Health collection included supplemental concentrated insulin, advanced glucose monitoring devices or sensors, artificial pancreas, and ready-to-use auto-injectors. In conclusion, diabetes is becoming a more prevalent disease. This condition affects the way your body produces and uses insulin, an essential component to fueling your body. There are various types of diabetics, type 2 being the most common. Prevention is the key to treatment. Early detection from a physician, along with proper nutrition and active lifestyle choices, is recommended. Thank you.